Good evening, everyone, and welcome to a live webinar on Budget Healthcare Outlook 2025 Reasons to Cheer and Points of Contention. We are thrilled to have an expert panel joined us today evening talking about the Union Budget 2025, which was given by the FM today morning. So now, quickly, let me introduce you to our esteemed panelist, Dr. Ajay Kumar, founder and executive chairman, Healthcare Global Enterprises Limited. Thanks a lot, Dr. Ajay, for joining in for this important session. Next, we have Mr. Namit Joshi, Commercial Director, Sentinel Pharmaceuticals and Chairman, PharmaExcel. Thanks a lot, Mr. Joshi, for joining in. And we have Mr. Vishal Bali, Executive Chairman, Asia Healthcare Holdings. Thanks, Mr. Bali, for taking out time. And next, we have Dr. Suchin Bajaj, Founder, Director, Ujala Cygnus Hospital. Again, Dr. Suchin, thanks a lot for joining. We have Mr. Banu Prakash Kalmat, SJ, Partner Health and Healthcare Industry Leader, Grant Thornton Bharat LLP. Thanks a lot, Mr. Prakash, for joining in. And with me, I have Mr. Vikas Dandekar, Editor, Pharma and Healthcare ET Prime, and ET Healthcare and ET Pharma. So we have only 60 minutes, and I think there is a lot of things to be discussed. So let me put out the first question. What is your immediate reaction to the healthcare allocations in the union budget for the financial year 2025 to 2026? Are you satisfied with the allocation of 98,311 crore for the healthcare sector, which I think is approximately 10% increase from the previous year allocation? So if I'm wrong, you can also let me know if the 10 is it 10% or more than that. How does this budget fare in terms of supporting the healthcare sector? I would like to go to Dr. Ajay first. Dr. Ajay, Yogi.
Thank you. To put it simply, as I always say, I am disappointed with this budget. I look for more things. And one of the things is a 10% increase. If it is really there, how it is allocated is important. My issue is, while they have done a good job of taking the customs, bringing it down to 5% or zero, it makes about 5 to 10% difference in the cost of the drugs. At the same time, they have not addressed the issue of how we can bring parity in healthcare insurance across India. What I call as universal healthcare has not been addressed. Repeatedly, they have not addressed this. And second thing is, while they have done something about the middle class, the taxes 12, they have not really addressed how are we going to take care of healthcare fund, which is what they should have done. In my view, when you say 80,000 is saved for middle class, they could have said 10,000 will be cess. So that could be used for the funding of healthcare across India, universal healthcare. So we have to innovate. Where I see here is there's no innovation. Even the cancer centers and clinics they're doing is, in my view, it is completely thoughtless. You can't have cancer clinics everywhere. It is a very focused treatment. Continuity of care, recurrence should not happen. Whoever has advised has really not advised them properly, in my view. And same thing, medical colleges, having so many medical colleges, not how quality of medical colleges is important. So all these has to be addressed in a proper way, which I think has been not addressed here. And they should really allocate and do a thoughtful way of doing it as we go forward. I feel they have not applied their mind to this, in my view.
Okay. I would also request all the other panelists to keep the views a little crisp. We have a lot of questions and specific questions on each segments. Thanks a lot for that crisp answer, Dr. Ajay. Thoughtless and disappointing is what is coming. I would go to Mr. Vishal Bali. Your thoughts, sir.
Yeah, thank you, Pratibha. Delighted to be on the panel, like always. I think there is a complete ignorance of this sector, to say the least. And this has now happened for a couple of years in succession. And every budget just addresses one or two, tweaked areas rather than anything which is required from a disruption of the healthcare availability in this country. And given the demand-supply gap of healthcare across India, I don't think these tweaks will give us anything substantial to fill up this gap. And if at one end we are talking about Viksit Bharat, the pillar of that is healthcare, and then we have these kind of initiatives to be done. I really don't know where the thought of development is, and which are the enablers that we will actually require towards that enablement of a developed country. Very, very disappointed again with the way that this budget has come across as far as healthcare is concerned.
Yeah, ignorance of the sector in succession was the line. Yes. So it does pain for us as well. So let me go to Dr. Suchin. Your views, sir.
Thank you very much, Pratibha ji and Vikas ji. Three, four issues, I think. One is that the budget this year is proposing about 98,000 crores. Last year's health budget was 90,658 crores. So only about a 7 crore increase, which is, I think, only about 7-8%, not really even 10%. Last year, we had seen a mild increase from 80,000 to 91,000, but this year the increase has been even lesser. Adding to the points that Dr. Ajay Kumar and Vishal ji have already raised, there is no support for healthcare workers this year, which has been enunciated. Last year, we had seen that some ASHA workers and Anganwadi workers had been extended the Ayushman scheme, but this year there's no mention of any healthcare workers. Also, the Ayushman scheme, we work a lot for Ayushman patients, and there's always a cash crunch there. So this year, the allocation is 9,000 crores. If you see, there are 50 crore people covered under Ayushman right now, and with the above 70 coverage also proposed, I think the coverage will rise, multifold. If you see 9,000 crores, that's about only 180 rupees per person. That is the coverage that the government has proposed. So there will be a huge lack of funds for Ayushman schemes in this year going forward, I'm afraid, and the hospitals are in for a tough time. Haryana is already announced a strike from tomorrow onwards. They are not going to honor any Ayushman patients, the Haryana IMA has announced. So this, I'm afraid, will increase to more states if this funding remains the same.
Okay. Thanks a lot for your views, Dr. Bajaj. I'll go to Mr. Namit Joshi, maybe on the pharma angle, if you can look into the budget and your perspective, sir.
So thanks, Pratibha. As shared by my other colleagues, I think first we have to identify out of 98,000 what is the kitty of pharmaceutical, because healthcare is a very big value chain. And where do we stand in pharma healthcare? Still, what we are facing currently is that the conflict between innovation and generics, and definitely pharma industry look forward for more investments, more rebates into the innovation side. Otherwise, we'll keep on shrinking both on domestic front as well as on export front. So, in my view, I think this budget has supported. This budget has supported more of MSME sector and certain life-saving medicines, 36 life-saving medicines where the basic custom duty has been waived off. There are certain patient assistance program. I think that is a good initiative which government has taken in terms of including 36, 37 more medicines under the patient assistance program. Because right now, without innovation, we would be looking forward keenly for the patient assistance program and inclusion of more drugs for rare disorders and cancer treatments. So on the whole, it is sort of quite a status quo budget for pharmaceutical industry.
Thanks a lot, Mr. Joshi. I would go to Mr. Banu. If you can just give us like a wholesome thing on the life sciences, both the healthcare and the pharma side angles.
Sure, thank you. I think it's a mixed bag. There are a few good things which I can probably cover is about increasing the medical seats, giving the boost on cancer care. Yes, the quantum could have been definitely better. I think even the outlay of 98,000 crores, the expectation was much more than that for us to reach the 2.5% of the GDP. But I think if you have to really look at some of the aspects, there was also an expectation on the PLI that has not been covered. Some elements are there, some elements they could have been better. That's my take. Yeah.
Okay, so now I'll bring in Mr. Vikas. Sir, you had pertinent questions, right, on cancer care centers and everything.
Yeah. Right. Thank you so much, Pratibha, and thank you so much, all our esteemed speakers. Dr. Ajay Kumar, you will know a lot more about patient assistance programs than all of us here. And this has been a topic of controversy. Patient assistance program had come under the lens of the government. Now there is a waiver of duties, but again there is a caveat that this will apply. The waiver will apply only if the drugs are supplied entirely free to the patients. How much of an impact do you think this probably will be able to make? What could have been done better?
I think it is a good thought, and I'm glad they have waived it. And also, I am happy that they have insisted that the drug be supplied free. Because what happens in real practice is, if the patient requires, let us say, courses will be free. So that really helps the patient quite a bit in terms of costing. Even if it is, 5 to 10% lower, those things will help quite a bit in terms of what they get. But when the question comes up, when they're already giving free, the beneficiary is not the patient, it is that pharma company which is paying less. So already it is being given free. So I don't understand the real reason behind it. Maybe they want to incentivize the pharma to give more free because they are acquiring at a lower price. That is my only thinking right off the bat at this point. But whatever it is, for me, the patient should benefit. Is the patient going to benefit more? Hopefully, the pharma will come back and say, "I will give you more free drugs," because now whatever I give free is less customs duty. So that is my only hope here.
Right. Dr. Shuchin Bajaj, you would like to add to that, sir, on whether it really makes a good impact on the accessibility of such high-priced drugs?
I think, as Dr. Ajay Kumar said, that this is an incentive more to pharma companies, and I think this is to enable access to drugs. Patients are already getting it free, but the pharma companies were not really incentivized to offer it free early on. But this is, I think, a good step. It will provide some incentive to pharma companies to provide these drugs, and especially the customs duty cut also on rare diseases, chronic diseases, and cancer drugs, with some of them put in a lower GST slab also. I think these
Right.
are some of the things that will help the patient to get more affordable medicines.
Right. And you have gone deeper into, more than even the district hospitals. How do you see that coming along? Earlier, Dr. Ajay Kumar also mentioned if, whether really it will help to have 200 cancer centers, because it's far more specialized. The requirements are far more specific.
I think the government has clearly said that these are only daycare cancer centers. 200 of them will be set up. So these are not like comprehensive oncology centers with radiation or medical oncology and surgical oncology. These are only daycare chemo centers. I think what they will help in is more in early detection, if they are tuned towards that rather than just providing curative chemos. And second, I think if the patient goes to a bigger city center, has their initial treatment, and then just requires chemo, they can come back to these daycare centers and get it done over, the next 6 months, 8 months, 1 year, whatever they require. And they don't need to travel to the big city repeatedly, which, as we all know, causes great financial hardships to
Yeah.
the community. So I think in that sense, it's a good start. Of course, having these fully integrated oncology centers will take some time. We are trying to do that. Ajay Kumar sir is the pioneer in that, and I think he has reached out to more people than anyone else in the world. But these are, I think, good steps by the government. It will take some more time for them to get to fully integrated centers, but this is a good step.
Right. Vishal, what would be your reaction to that? You've expressed overall it could have been far better, but does this really make some definitive progressive move?
Yeah, so because see, cancer is the fastest growing disease now. Not just in India but world over, and providing some kind of a focus to that disease is a good step. Now, medical oncology is a large portion of the entire treatment profile of these patients.
Right.
And as Dr. Ajay was also saying, I think it's a question of there are various initiatives that have happened even in the past as far as cancer care is concerned. And this is one amongst them. Frankly, my biggest issue, Vikas, is always that, there are announcements that are made and the execution of those announcements, right?
Yeah.
So even if we were to just do a fact check of all the announcements that have happened around the various initiatives that have been announced in the previous years, whether it is medical colleges, whether it is adding new seats, whether it is the multiple, aims that have been described to have got started or are in the pipeline. You see those numbers and see at the end of the day, the execution that has happened. So I think the budget provides a very important step towards and a direction, not only around the capital allocation, but also in terms of the execution. And it is very important that one must also go back, and I think it is also the government's prerogative to go back and see all that they have announced, how much of it has actually got initiated in action. And likewise, if you're talking about 200 cancer centers, so both Dr. Ajay and Sachin are right. At the end of the day, who's going to man these cancer centers? Where are the clinicians who are going to man these cancer centers? Where are the nurses who are going to man these cancer centers? Where are who is actually going to monitor the progress of these patients? We have an absolute dearth of good clinical talent. And particularly now we are talking about super specialty care because cancer is super specialty care. And we are now talking about this across 200 cancer centers around the country. What is the plan to execute and where are the clinicians who will execute this? So I think while, rightly so, there is a framework, there is a focus, there is a push, but ultimately the goal should be to get these to fruition so that patient care and patient accessibility improves. But I think that is where we are always, not clear whether all these announcements are actually getting to fruition.
Yeah. But this time, I think, they have put a kind of a ambitious goal because the FM mentioned that 25-26 itself will see 200 centers. So we'll have to revisit this maybe the next time we again do this discussion.
And
So,
also, the 10,000 additional medical
yeah,
seats.
exactly.
It is not about the number of medical college and medical seats. There is no teaching faculty in this country.
Yeah.
Right? You can have any number of medical seats, but what is the plan to get enough and more of teaching faculty also to come into these medical colleges? And that is the reason why progress is not happening. Because
Right.
there is, nobody wants to now be a professor in any of the medical colleges, and particularly as we go down the district and the rural medical colleges as they were positioned to be. So,
Right.
what is the plan to get some teaching faculty in all these
Right.
colleges?
Right. Let me ask you a bolt-on question to that. You've had the hospital administration hat, and you also have a hat of investors hat. There is also a word on startups and fund of funds, something to do with deep tech. Do you think that spurs innovation? Does it really take it to the next level? I mean, the relevance is very high, seeing what China has been doing.
Correct. So because I think, again, as I said, that, healthcare needs massive disruption for accessibility in this country. And that requires a combination of capital, talent, and innovation. So disruption or, deep tech, enablement, AI, all these areas require a huge amount of capital allocation by the government for these to become a reality. So until and unless, there is, so at one point we are talking about a 7% increase in the overall healthcare allocation for the country, which is 1.4 billion people now. How are all these initiatives going to get funded? So this becomes like just an initiative from a feel-good factor, But what is backing these initiatives? Where is the capital allocation to back these initiatives? In fact, Ayushman Bharat is a classic example.
Yep.
Great thought in terms of, having universal healthcare. Great thought in terms of, covering millions of people under Ayushman Bharat. But Ayushman Bharat as a scheme has not been capitalized for the next 25 years. So already you have people who are or providers who are not willing to take Ayushman Bharat patients because the payer system has just not got created behind that massive scheme. So again, good announcement, good focus, but enablement, execution, capitalization, I think we just falter on all of these areas. And that's why these schemes then end up becoming, or these initiatives end up becoming just for that particular year or for the next year. And then nobody even bothers about them.
The struggles for hospitals like Dr. Bajaj's probably gets very, very tough to handle, because governments, state governments will not be able to manage this. Yeah, well taken. Namit, you mentioned about the fight between innovation and generic, and how do you intend to tackle it? And then there is this big tariff cloud also on the heads of Indian generic companies. Where do you see that going?
So the biggest challenge what we are facing is not one fold, but it's multifold actually. One challenge what we have is the access to medicine. So to serve 1.4 billion population, the medicine should also be made available. And unfortunately, we are still struggling to make it happen to reach every corner. We can make a ballot box reach everywhere, but medicine's accessibility is still a big challenge for us. The second thing is, even if where the medicine accessibility is there, the responsible use of medicine, the misuse of antibiotics is the second big menace in India. Now, we have been identified as the antimicrobial resistance hub. China do not permit the practices, so that is another challenge. Now, if you equate your access to medicine with innovation, now we are fitting in between. Now, for innovating a medicine, as Dr. Bali rightly pointed out, you need a humongous amount of capital. And for that, even the R&D budget earlier, the schemes were that we were getting subsidy of around income tax benefit of around 200% on the R&D budgets, but still it is not being brought in back. And we are wondering that without the capital, how would you innovate? And without the innovation, how would you how can you support the healthcare system with the cost-effective medicines in the region? On top of it, the innovations which are coming from outside India, we are waiving off the duties, fine, that is a good step. But then it is all supporting the multinationals who want to save money wherever they can with the intention that they are participating in patient access program. But India should also have their own patient assistance program where they innovate, they try within their own population, and then become an innovative leader in the industry. So we have multiple challenges. So there is a big dichotomy.
Yeah, absolutely. Yeah. So, Pratibha, you want to take it ahead from there? The next
Yeah,
set
yeah.
of questions.
Yeah. I just wanted to again revisit that question on the cancer care centers. Dr. Ajay, you have any more pointers to add
Yeah.
in, because you are not so happy with that, cancer care centers. So,
Yeah.
any thoughts on that, doctor?
As a practicing oncologist who has also started 26 oncology comprehensive centers, while you can have a hub and spoke model, have clinics, but the important thing is cancer is unfortunately not a disease of convenience. If you want to treat the cancer the first way, you have to be multidisciplinary clinic, do the right thing. Today we are talking about precision medicine, genomics. See, I'm not talking about rich or poor. I'm talking about what is the right treatment for a cancer patient. Cancer doesn't know they are rich or poor. It knows only one thing: how am I going to win this battle? For us, we have to win the battle over cancer. For that requires, a multidisciplinary. What is the time of chemotherapy? When am I going to do radiation? Am I going to do surgery? Am I going to change the therapy? It's a very complex, even after 50 years of cancer specialty, I have 25 years in US and India, I can tell you I'm not an expert because it's an enigma. So when there's such a complicated situation, the government says, I will open some cancer clinics, like you go and like buying a biscuit or something, you go and take a treatment there. It is not possible. And like, I said, and even Vishal mentioned, the expertise is needed. Who is going to sit there in the clinic expertise? Which expert? So, and it is not a menu. It is not something you follow protocol. It is a lot more complicated. So I think government is doing a great disservice, in my view, by trying to start and giving a misconception to the public at large about what is cancer treatment. They're trying to simplify it. If they really want to, they should document the data. And data is everything. Show how many people who are treated with head and neck cancer are doing good. They are not having recurrence here compared to the major center. Let them do that. Let them be a monitoring agency. They will have the answer. Because it is really a terrible practice to simplify cancer care. Because that is why India is always told, oh, people come with advanced cancers, there is recurrences. People, that is why cancer has got a bad name. People, when we talk about corruption or something, ill of society, they say cancer of the society. Because of these reasons. So we have to redefine cancer. We have to redefine cancer care. And I can tell you, because I deal with advanced and recurrent tumors, it is a very complex situation. You cannot say, I will have an infusion center and go. Possibility of a hub and spoke model where you do some treatment but it has to be monitored very closely. The spoke has to be monitored by the hub. Are we there yet? No, certainly we are not there. So I think whoever has given advice to them has not really understood the complexity, and they have not taken advice from the right people. I'm sorry to say that.
Okay. So let me go to the next one. One of the key misses in the budget is a GST rationalization in healthcare, particularly medical devices. So increasing the tax exemption for preventive health checkups was also, which we thought would come in. And these are certain misses, big misses. So what are the thoughts? I would go to Mr. Banu on this first, please.
Yeah, I think you're right, Pratibha. Thanks for this. So the expectation of making healthcare services moving from exempted to zero rate structure so that it can bring down the cost of healthcare has been a long-standing demand. Every year that is there in the discussion, but unfortunately it doesn't happen. I think somewhere last year we had heard that it may be more on in terms of reducing the input, but I think that has also not seen too much of action happening on reducing the duties for the inputs. I think only one aspect is probably this year there is some references on the cancer drugs being reducing the DCD. The way I read is it will probably give an additional budget for the pharma companies, because at the end of the day their overall program they can distribute a higher number. But in effect, that's a long-standing demand. It will continue to be there as one of the sore point for this year.
Okay, so let me quickly go to Mr. Bali. Sir, what is your thoughts on the GST rationalization in healthcare, particularly in the medical?
Yeah, so there were various elements of the GST rationalization, Pratibha, including the one on insurance, on health insurance, right? And none of those steps have been taken. You look at the macro world what we are living in right now, with all the geopolitical issues going on, with this massive overhang of tariffs that we really don't know where it is going to take. The rupee has already depreciated over the last 15 days, multiple times and so the dollar has already got strengthened. We are importing medical equipment almost to the tune of about 85 to 90% in this country, right? So the input cost over the last 15 days has already increased for all healthcare providers. And in that kind of a macroeconomic situation, if you do not come back and start thinking about where is the entire push for indigenization, whether it is for medical equipment, whether it is for pharmaceuticals, whether it is for any of the other inputs required for healthcare accessibility in this country, I think we are doing ourselves a lot of disservice. Because at one end, we keep on talking about the fact that accessibility of healthcare is a big issue in this country, affordability of healthcare is a big issue in this country. And then when all these macroeconomic issues are staring at us from everywhere, we don't give any kind of incentivization for these production-linked issues which are there, which are very much required on the medical technology and the biopharmaceutical or the pharmaceutical side. I think that is the reality. And that just goes to show that when you are not looking at this as a focal point, I mean, we are talking about forever that healthcare has to be a priority sector for the country like infrastructure. And we don't come back with anything. So therefore, year on year, when the cost increases happen, then who's worried about it then, right? Because there is, on the other side, there is no enablement to reduce the cost. So I think we live in this very dichotomous world, as Amit very clearly said. And unless the government decides that there is a lot more that they need to do for enablement, and not as an end provider, but for the enablement of this sector and for the enablement of the larger healthcare ecosystem, we are going to continuously see an inflationary environment as far as healthcare affordability is concerned. And there is no way that we will be ever able to stop it.
Okay. So let me go to Dr. Suchin. Any thoughts on the GST aspects?
We've been advocating it forever, I feel now. And, because see, everything we buy to treat patients, right from screening them to, even inputting their name and telephone number data to the laptops, the computers, everything attracts GST, all medicines. And unfortunately, we do not have any set off at all. And I don't understand why the government feels it's a very complicated step. It's just going from exempt to 0%, or I think the industry bodies were even ready to bear a minimal GST slab lower than 5% if the government could have brought it in. And we were happy to take it on because of the immense benefits that we could have provided the patients if that rationalization step had been brought about. We do not have any explanations yet from the government why they are afraid to pursue it, because every time we do go to the government to advocate for it, they're always welcoming of it and they listen to us carefully and they say, yes, it's a good step. We should definitely consider it. The finance minister herself has said that it is something that should be considered proactively. But the reason that it's not been brought about, I have no clear understanding of it. It is definitely a big miss and definitely very disappointing for all of us.
I think we should not lose heart. We keep pushing for it. I will bring in Vikas, sir. You had something on the life-saving drugs as well, right? So you're on mute.
I'm sorry, yeah. No, the same issue of affordability again keeps coming back, and as most of our speakers mentioned, the way I think it should be seen is like the first few minutes. Actually, the FM mentioned about working towards high quality, affordable, comprehensive healthcare. I think that part has been said very well, but I think we are still moving in like silos and piecemeal. So, in terms of a comprehensive plan, I think that still keeps beating us. Again, on the say, for example, on the innovation side, there has been a couple of mentions on innovation, and I was recently at a event. I mean, I was actually enthused and very optimistic about the way small entrepreneurs are also trying to make tweaks in the technology so that mRNA can be harnessed to its fullest. So many other tweaks that can be done, and additional innovations that can be done. Some of the things that probably are costing like $15,000 per microfluidic chip can be available at around 2,000, 3,000 rupees. Now, if these innovations are to be really brought up to a level where it can actually gain scale, there is need for something much bigger. So, I mean, since all of you have actually seen companies, nurtured companies, and kind of grown companies, I'd like to have one round from all of you, again, starting with Dr. Ajay Kumar, on exactly how do you think that gap can be bridged?
I think we have to go back to the basic fundamentals. Like I mentioned, when you take a disease like cancer, which is so complex, how do we treat everybody same way? And cost is always a factor. But in my view, I am a little bit of a contrarian view. If you treat the cancer first time right way, without compromising on the cost, I think the life cycle of the patient, the cost spent is far less. Today, we are in the era of genomics, proteomics, and people always talk about the cost, but globally it is becoming accepted that every patients need a genomic test, sequencing, either 500 sequencing or complete gene sequencing. And if we do everyone, the cost will actually come down. Today, the cost has come down for 4-5 lakhs to 50,000, 60,000. And we can bring it down to $100. That is our goal. And make sure, and in that scenario, if we apply the treatment right for the patient based on these, genomics data, proteomics data, and you can really go for a cure, because the randomized trial in the olden days, 50% will respond, the other 50% it may be harming them, not only responding. So taking this cue, we know cancer is an inflammatory disease. There is similarity with diabetes, there is similarity with cardiovascular, Alzheimer's. So there are so many commonalities coming into picture as we understand this disease more and more. And lifestyle disease. For example, one of the simple ways I always say is, if you ban tobacco, 40% of the diseases are gone. We advocate banning tobacco, but the government feels it's a high revenue source. So it's as simple as that. Tobacco, chewing, or smoking is the single most cost. So we are not thinking on those things. We are thinking about mRNAs, this and all, but we have not applied our mind to simple solutions. So in my view, after 50 years, I feel there is a lot of things we can do, apply, if we just say, okay, tomorrow we are going to restrict that, ban tobacco. Tomorrow we are going to use certain things in dietary things. For example, processed food. All of this can make a huge difference in the environment for herbicides, pesticides. We have documented evidence for breast cancer, for example. Normal breast, if you do a biopsy in a patient with breast cancer on the, let's say, the right side breast, we see products of herbicides and pesticides.
I think we've got
So we know
Dr.
these are
Ajay.
the ones which are causing to talk about cost and this and that and all that. How are we going to identify IK? Please go ahead.
Right. Sorry, Dr. Ajay Kumar, actually we missed some of your important point towards the end, but we'll go back on that a little later. Dr. Bajaj, what would be your ways of suggesting where exactly should we do this innovative bit? What exactly can be the most impactful thing to do?
I think for healthcare, there are some innovations that have been proposed. So, healthcare industry, I think, is at the cusp of a technological revolution. I think we are the only industry that has not become completely unrecognizable from what it was 10, 15 years ago, unlike banking or, shopping, retail, etc., which have completely become unrecognizable now. Healthcare is yet to do that. I think it will become in the next 2 to 3 years, is what I feel, that we will get a large technological input. So the government initiative on setting up a large AI center, I think will
Yes.
be working a lot on healthcare issues as well. I feel if you go to the Bay Area these days, I think all my friends were there see more medical startups than anything else. It's a huge amount of medical startups on the West Coast. So I think that will come here as well. The initiative on gig economy workers, offering them healthcare initiatives, etc., along with other benefits by their mandatory registration on the eShram portal. I think that is another thing that will be very, very useful for healthcare workers as well going forward. Uh, Rest, I think the focus on increasing seats comes with a caveat that has been raised, I think, both by Dr. Ajay Kumar and Vishalji, about the need for qualified and high quality medical faculty. We are increasing medical seats by 10,000 this year, in addition to what we've already raised, and the aim is to increase it by more than 7 times that number in the next few years. The need for quality, I think, is not really, it doesn't need to be specified and mentioned a lot, because it is a huge need in medical education. And we should be very careful that we don't go the path of the multiple engineering and management institutes that have been set up across the country and are now, churning out graduates and postgraduates of a quality that leaves a lot to be desired. The NMC step about enabling medical teaching by any medical graduate, any MD post 3 years and any diploma holder post 5 years is a step which I feel the government is pushing towards enabling faculty for these new medical colleges. But I don't know if all MDs or all diploma holders are actually of the mindset or of qualification to have teaching capabilities for these undergraduate students and postgraduate students. That I think we need to discuss amongst ourselves as well as with NMC. But that is a step that the government really wants to push. They've been very vocal about it as well, and NMC has brought about the recommendations. The recommendations are already out in the public domain for public comments. So I think that is something that we all need to reflect and consider whether the quality that will be churned out by the new medical seats will be good enough to serve the community. As a provider of services in small towns, it's a very good step for us because it enables us to get access to qualified medical talent to serve the communities that we are serving. But again, most of the talent we are getting right now, we need to upskill and retrain them a lot before we deploy them fully. So I don't know how much more of that we'll need to do going into the future.
Sure. Right. Yeah, hopefully the all the buzz about AI and upskilling and center of excellence. She also mentioned about Atal Tinkering Labs. All of that probably will help in doing something better on the healthcare side. Banu, would you like to add something on the innovation part?
Sure. I think, there was a reference on the last year on the 5G labs being set up. I think I didn't see a reference on that, so probably hoping that there'll be something more coming on that front. They have talked about on the innovation front in terms of enhancing the reach by providing broadband network to all the PHCs. Hopefully, it will help to improve the accessibility of the healthcare. So if I have to really take a step back and see if I have to address the root cause of what we mentioned on how do we help or make better coverage or maybe make India better, more healthy India, the focus on preventive healthcare should continue. There is a lot of investment which is happening, but it needs a lot more. If you really look at on the rural side, the Saksham Anganwadi portion program, Jal Jeevan Mission, which improves the quality of life, makes more healthy living, but that needs a lot more to be done so that it can give a better output in the long run. On the healthcare front, I think one of the other demand was the priority sector lending. If that can bring in, because then it will also provide the sustenance for hospitals to more look at a long-term gestation for it to reach the break even and leave that much more money on the table for research and innovation. That's one of the healthcare. On the pharma, I think the long demand was on the research link incentive.
Yeah.
There is an announcement on the 20,000 crores being allocated for the technology, though not specifically for pharma. But hoping that should give some benefit to the pharma sector as well. But I think the research link incentive would have been a good one. I did read in the economic survey report there was a comparison of multiple countries. I think for the pharma sector or for the research, the way it was positioned was in India, the subsidy is still higher than others, whereas in developed countries, it's a lot more tax credit model. Given the way we are, I think research link incentive will probably will help us in the long run to increase the research and then maybe bring in some of the innovation better into the Indian market.
Right. Okay. We are very close to about 15 minutes left now. So, Pratibha, you want to touch upon the medical insurance side of it? It's an important point.
There was no mention of medical insurance mostly, and there was nothing. And I had something on medical tourism also. After listening to the panelists, I don't feel like asking them the question on medical tourism because I'm also slightly upset after listening to the experts. But still, let me ask the panelists about the insurance was not a major miss. Dr. Sachin, you were saying there was no mention of Ayushman Bharat scheme. Also, most of the hospital use it. So, how big miss is that? And there was, anyways, there was always a mention of medical tourism and Heal India initiative. So, how does that going to help? If you can talk about insurance on side and tourism on side, Dr. Suchin, your points.
I think the big thing about insurance was, I think, the increase in FDI from 74 to 100%. I think that will attract a lot more international investment, potentially leading to introduction of innovative insurance products and improved coverage options for citizens, especially for the missing middle, as we keep calling them, the people who are not covered by Ayushman on one side and the high cost private insurances or other central schemes on the other. So I think that is something that is providing a lot of hope to us on the medical insurance side. The Heal in India initiative was, although not mentioned in the speech a lot, but I think the government plans to promote medical tourism a lot. We are already seeing a lot of registrations on the site. We have also registered, even though we haven't got any further initiatives out of that. But I think the government is clearly focused that they aim to position India as a global hub for medical and wellness tourism. And we've got a lot of assurances saying that visa procedures will be simplified for medical value travel a lot, regardless of the country they are coming from. So those things I think will continue. The government has a focus on that. But these things really don't cover, as I said, the communities that we work in, the small towns, rural communities that are mostly dependent on either out of pocket or Ayushman Bharat PMJ schemes. The outlay for which continues to worry me a lot. The outlay is not at all commensurate with what the needs are, and we already see a lot of budget crunch in the states that we are working in. Jammu and Kashmir, there was payment delays lasting up to 7, 8 months last year. Haryana, as I said, the IMA has announced a strike starting from tomorrow because payments are not coming. Uttar Pradesh doing better than most other states, but still the population there is immense, and we need to have more budgets into this scheme. So 9,000 crores clearly not enough. I hope the government will have a relook at those numbers.
Thanks for summarizing that. But I would like to go to Dr. Ajay. What's your thoughts on the insurance side, which is lacking, and also about the medical tourism?
See, I have a very clear-cut thought, Tiba. I have studied the global insurance companies, and of course, US is different, but Brazil is one where they have successfully done. And even in India, the state of Orissa has done very well in Ayushman scheme. It has to be expanded, in my view, to cover all population. And I feel there should be a cess created, which we have recommended in terms of universal healthcare. India is a population is youth, 60-70% youth. So they can contribute. Like while I was in the US, I contributed. And today I can have free medical care. So what we have to do is to set up a large fund. It may require $200 billion or so. And this fund can actually, autonomous fund, which can take care of all diseases, these can cancer, related diseases, cardiovascular, and no limits. And it will be done as per what is the requirement, rather than saying, I will pay only for this, not for this, for this. So that way rich and poor are brought about, equality is brought about. And that is the need of the nation. That is the responsibility of the government. See, that is what they have to do. And this is where I think somehow they are lacking. And they are looking at half-baked measures like Ayushman scheme. They are all half-baked. And actually, when you treat a patient with Ayushman scheme, you're half treating them. You're not giving them full treatment. That is why recurrences may be high. And regarding the tourism, I believe tourism will do very well if government really leaves it alone. And I think government interference will muck it up. So I think the government is the best which counts the least. They should not really get into this, but monitor, make sure there is no abuse for foreign patients who come. But government should not get into this. I think India is well on the way to really become big capital of medical tourism, because our cost, our outcomes, when you look at it, is phenomenal compared to Europe or US. And people are beginning to recognize that. People are moving away from those and coming here. But we should nurture it and grow as private enterprise. Even government hospitals can offer it, become competitive with us, but that is not an issue. But government should not interfere, in my view. Okay. I may have to get off of the call. Is that okay with you?
Okay, sir. But one last final question, which I will be asking the panelists after the tourism and insurance question. How do you rate this budget? I know what would be the answer, but still, excellent, poor, or any term which you would want to rate
I
it.
think definitely poor in terms of healthcare.
Okay, thank you. Thank you so much for joining. Thank you.
Thank you
So,
so much. Thank you.
yeah, let me continue. Yeah, I would like to go to Mr. Vishal. Sir, your thoughts on the insurance side and the tourism, if you
Yeah,
can comment.
Pratibha. So I think as far as insurance is concerned, globally, when you take a look, insurance as a payer has driven healthcare access, right? That's the fundamental way in which people of any country where there is higher amount of access that has got created, it has all got created on the back of insurance. And insurance is a mechanism where everybody has to contribute, right? And so, for example, until and unless the span of insurance increases, right? See, it's not a question of 100% FDI, 74% FDI, 80% FDI. What is, you are only enabling international capital to come behind your insurance sector, period. If you take a look at how much of insurance access has got created within the population, whether on the private side or on the public side, over the last decade, you will actually be surprised that there is an absolute minuscule growth that is happening, right? So while growth is happening on year, but what we require to cover and where we are, there is a massive amount of gap. So FDI is not going to help us to increase access. FDI is going to help us to get some more capital into the insurance companies, which can then probably, have an agenda in terms of how they want to grow. But the enablement of that is purely regulatory. Like, for example, and I've said this many times before, we need a license to drive any vehicle, whether it's a scooter, it's a car, it's a truck, whatever it is. And when you go in for your first license, it is imperative that you also have health insurance along with your driving license, because you are taking insurance even for your vehicle. That if you go and crash it somewhere, a new vehicle always comes with an insurance, right? So you have taken insurance for your vehicle, but you have not made it imperative that the person who's driving that vehicle should also take insurance, right? So there is a fundamental thought process that needs to be followed, that how do you actually create insurance penetration by span, by having more number of people fall under the insurance umbrella. Now, whether it is public or private, that is on either side, but you have to make it imperative, right? And until unless we don't make it imperative and it continues to be a choice, we will not get the accessibility that we want, because more number of insured people in the country, it is not that everybody is going to utilize. Net, the premiums over a period of time may even reduce. But right now, if there is a smaller portion of the population that gets covered, the premiums are only going to keep on increasing, because you just don't have the width on which you can hedge a lot of this cost. So that is my view on insurance, that insurance by just enabling FDI is not going to help. Second, as far as medical tourism is concerned, I think sometimes we overrate some phenomena. Medical tourism started in many countries on the back of them being massive international tourism destinations, right? That aspect did not start because somebody wanted to create low-cost healthcare. I mean, Thailand is a classic example because Thailand is truly the originator of medical tourism in the world. But Thailand is a massive tourism destination for international people. People feel safe when they go there. How many international tourism arrivals are coming into India in spite of India being such a big country and being such a beautiful country, having everything that one can aspire as a tourist. But even today, tourists feel unsafe coming over here. And why is that so? Because, so you have to fundamentally, again, the moment we start turning around and saying that, yeah, medical tourism is a big space, is a big opportunity, unfortunately, it's a very small opportunity for the overall healthcare ecosystem that needs to get created in this country. So by overhyping it time and time again, what are we trying to actually, we have to get the fundamentals right. If we don't get the fundamentals right, we are creating a foundation which requires a massive span of change. We are talking about these enablers on top, which don't even impact 0.1% of healthcare issues of this country. So, I think more than medical tourism, if the finance minister was talking about a PLI scheme to change the entire medical technology world, that would have been a lot more focus. That you are creating a medtech industry in this country, almost akin to what China has done many, many years back. Because today we see that as a China plus one opportunity. So sometimes I feel that, what we are trying to solve and where our focus is and where the world needs change as far as India is concerned, we need to reimagine ourselves.
Okay. I'll go to Mr. Banu. Your thoughts on insurance and the tourism.
Okay, I think a lot has been covered already. I'll probably just touch on one element. I mean, if you really look at the missing middle, which is 40% of the population, it is a place which is neither covered by public government insurance or by the private insurance, because the belief is, yes, they don't come under the category where the government has to support, but there is also a belief that they can't pay for it. So if we have to increase the insurance penetration, maybe to look at copay. That was something which was discussed. I think that's something which is seriously we should pursue on how do we make it copay, give some support at the same time, also make them accountable to pay for a premium, so that then the coverage becomes better. I'm sure, as Vishal mentioned, as the insurance penetration becomes better, it gives a better access to the healthcare. That's all I have to cover.
Yeah. So I think we have just 3 minutes. I would go to all the panelists on the rating. I know how it feels like. You can also be a little optimistic, I would say.
I wanted to add
Yeah.
something before we go to the last round,
Yeah,
Pratibha.
sir. Yeah, sir. Please.
Yeah, I mean, taking from what Vishal mentioned, and the crux of it is there are a lot of inadequacies, and these need to be filled. From having a more like a progressive PLI scheme or doing a more robust insurance scheme. My point is, like, over the last 25-30 years that we have actually seen our healthcare and pharma industry both, they've both grown multiple folds. Today, Dr. Bajaj's model is lapped up very quickly. HCG is also handled by investors. Vishal probably is scanning every bit and cranny of the country to know exactly where he can put in more money. Everything that can be actually taken by investors are taken. So with all the limitations that we have actually discussed, we still have investors coming into this country with hopes and optimism that, okay, this can actually go to this 5x, 10x, whatever your investment targets could be. What exactly is driving that change? The inadequacies have been seen. From the pharma corollary, if you say, DPCO has been the biggest bane, but industries have grown. Healthcare system is so much problematic from what we see, the affordability part, the access issues, cancer care not being adequate. What is it that actually still drives this country? That's the kind of an enigma. Vishal.
So because you're so right, you look at the amount of foreign capital that has come into the country on the back of, again, this demand-supply gap that exists within healthcare in India. And that will continue to happen. I think, but also if you take a look at it, Vikas, a large portion of that capital is actually going into urban India even today.
Oh,
So while many of us are trying very hard to go into tier 2 cities and grow healthcare access in tier 2 cities, but we also now begin to recognize that until and unless there is massive creation of healthcare access, even on the public side, what will create the balance between the private and the public side. India is a country which is getting served by private institutions, by private healthcare, and for the and that, if you see the kind of population that the private healthcare can cover, beyond a point, India will not be able to get access to that private healthcare, fundamentally because private capital wants return and will ultimately end up going largely to the urban metro tier 1, tier 2 cities. But the tier 3, tier 4, tier 5, tier 3, tier 4 right now, tier 5 cities are not even described today. But I think what is going to happen is that we will come to a stage where there is a lot of capital which is going onto the private side, and rightly so, because if the public side is not going to fund healthcare, then that demand is being fueled by the private side, and that demand is being met by the private side. So, and that will continue to happen. But what about the rest of the world? I mean, what about the rest of the country? What about, providing access to them? If public healthcare is not able to provide access to them, then we will remain an undernourished country as far as healthcare provision is concerned.
right.
I think both
Yeah.
have a role to play. We are massively skewed today on the back of, all the private enterprise that has backed healthcare enterprises in this country.
Sure. Oh yeah, absolutely. That's a great point. Perfect. All right. So yeah, the final round, Pratibha will ask for some ratings. So yeah, go ahead, Pratibha.
Yeah, I just wanted to know how do you rate the Union Budget 2025 in one word, or if you can scale it in 1 to 10. Mr. Bali?
5 on 10, average.
Okay. Dr. Suchin?
I think it's a mixed bag. So I would give it about 6.5 on 10.
Okay. You give ranks like the maths teacher. Anyways, Mr. Banu?
I would probably say, if I have to really look at the investment on the hinterland, the rural side, there's a lot which is happening. On the urban side, especially for the private hospital, the healthcare sector, a lot could have been done. So from that perspective, if I have to take a holistic view, I would probably be still more optimistic than what others are covering. I would probably say 7. Yeah.
Okay. And Mr. Joshi, your ratings would be?
Realizing the challenges at both the ends between the policymakers and the executors, I think I would also like to go ahead with Mr. Bhanu in terms of rating this budget as 7, with lot of hopes around this that we will scale up to 8, 9, 10.
Oh, like the English teachers in the school. Anyways, thanks a lot. On that note, thank you so much to each one of the panelists. We will keep coming in. Please do write for us if you have anything like, any expert knowledge. If you want to share with us, keep writing for ET Health World and ET Pharma as well. Thanks a lot to each panelist once again. We'll keep bothering you for such sessions. Thank you.